month of February is Black History Month and American Heart Month. And according to the CDC, Black Americans are at an increased risk of getting heart disease and stroke, diseases that are a leading cause of death in the U.S. Christina Burgess spoke with a local doctor on why that is and how adults can practice prevention.
According to the CDC, heart disease is the #1 killer for adults in the U.S., and strokes are number 5. And for Black Americans, the risk of getting these diseases is only higher.
They suffer a lot worse issues with heart disease and stroke than most other races or ethnicity.
Family physician and residency program director at Texas Tech Family Medicine Permian Basin, Dr. Ike Okua, explains that many factors come into play as to why this is, like lack of access to health care, bad eating habits, and not enough exercise.
So if you're not eating right, exercising and things like that, your cholesterol could be very, very high, and it affects Black folks also. If you're not physically active, or what you're eating and things like that, those things contribute. Man, if we can just take a little bit more, the carrots and the fruits and things like that, that would really be very great. Other preventive things would include, if you smoke. I mean, smoking is one of all those things that just adds to all these things, so that would be very good.
Conditions that can also increase the risk of heart disease and stroke are high blood pressure, high cholesterol, diabetes, and obesity. But according to Dr. Okua, you can assess your risk and prevent an emergency by scheduling an appointment with your doctor and going over your family medical history.
Come see us. Come see your doctor. Come get screened. We can just really kind of get on top of this at the right time to prevent the downstream effect, i.e. when things are already very bad, when you've already had a stroke or a heart attack and things like that, or when diabetes has damaged your kidneys. But if we can screen you earlier, it's a lot better.
By the way, studies show that Black Americans were actually 30% more likely to die from heart disease than white Americans.